listening and addressing the underlying cause of your health issues? IWC Primary Care, part of the esteemed Sharp Community Medical Group, has opened a new clinic in Spring Valley. Our mission is to provide high-quality medical care in a compassionate and patient-centered environment. We are providers who listen and providers who care. IWC Primary Care Clinic is located in Spring Valley at 10225 Austin Drive, Suite 105, conveniently situated in the same building as Sharp Care. We accept all Sharp health plans, as well as most major insurance plans, such as Medicare Advantage and commercial plans. IWC Primary Care, a Sharp Community Medical Group clinic, owned and directed by Dr. Suzanne Afflalo. Visit our website, iwcprimarycare.com, or call to book an appointment, 858-648-0755.
Well, welcome. We are back here on a fourth Thursday with none other than Dr. Afflalo. Ask Dr. Afflalo, Happy New Year, happy all of the wonderful things that you're expecting. We are in January. Matter of fact, we're close to the end of January, so you know what that means, that if we're at the end of January, that means that it's going to be the beginning of February, and that means that there's going to be the health clinic, and we're going to hear more about that coming up. But without further ado, ladies and gentlemen, the incomparable Dr. Suzanne Afflalo.
Well, thank you, Dr. T. Welcome. Happy New Year to everyone. And I'm glad to be back. I think I missed Thanksgiving and Christmas because they landed somewhere at the end of the month. So I've had a hiatus for a few months. I needed that break anyway. But so I do want to say that today we're going to be really speaking about health insurance and how to navigate through that, how to find a good provider. So what I've done is I've brought a guest speaker. Yes.
Well, who is your guest speaker? Who is your guest speaker today?
His name is Mr. Grady Gordon, and I'm going to have him introduce himself and let him tell the folks a little bit about him.
Okay. Good evening, everybody out there in the listening world. My name is Grady Gordon. I am I'm the business manager behind IWC Primary Care, behind the scenes, behind the operations, behind all the wonderful care that's being administered. I'm in the background working to support, and I embrace my role. I'm originally from Alabama, a Navy veteran. I have a background in chemical engineering, and I saw an opportunity to bring over my skill sets and technology foundations over into healthcare, and I've been there loving my role ever since.
Well, I just got to ask the question. I was in a conversation today, and they were talking about receiving good health care within the community. And they asked the question, and Dr. Afflalo, this is how it came up. They said, well, where is Kaiser, where is Sharps, and where is Script Health? I said, I don't know, but I know where IWC Healthcare Primary Care is, and they are here to help the community. So I'm very excited about having you both on tonight. And I just want to know, can we get good insurance in the community so that we can stay healthy?
Yes, sir. Right now it's open enrollment, and we just finished the traditional open enrollment that people often know about, the October through December run. But then there's another quieter open enrollment period going on through January through March. So right now it's the time to be out shopping, especially if you're in the Medicare age range. You got to exercise that Cadillac insurance plan and actually sign up for something that's going to benefit yourself.
Mm-hmm. So let me ask you a question. If I was to come to IWC Primary Care,
Mm-hmm.
could you all tell me what would be the best insurance for me to get so that I can come to y'all and get your full services with the full needs? Not that you got to be biased, but I just, you know how they say now, look, you don't have to tell me what to get, but circle it and walk out.
I think what we need to say is, number one, before you come to the clinic, you probably need to have a insurance broker or manager or someone to help you navigate through all of the different insurances, because you need to find something that's going to meet your needs. For Medicare, there's several different options, and Mr. Grady can go through that. But it depends on the age group, obviously, but Medicare, we do take a lot of Medicare patients because we're really focusing on taking care of our seniors. But there's so many plans out there, you have to figure out what's going to be best for you. Some of them have, if it's Senior Advantage, they're going to provide enough funding or care for vision and dental. The traditional package of just the senior healthcare Medicare is going to just cover your basics, clinic, and hospitalization. So you have to speak to your agent or your broker to say, this is what I need and this is how much I can come out of my pocket with. What kinds of insurances are out there that can fit my needs, including things like deductibles and co-pays. Sometimes you have to go to the clinic and you have to pay part of it. So maybe it's a $20, $50, depending on what you sign up for, determines your copay. And if you have a deductible that you have to pay throughout the year, and then when you finish that deductible, the rest of it's free. So I'm going to let Mr. Grady go through the fact that there are insurances out there, but you can go on our website and then you can see all the ones that we accept. And then that way you can find out, if it's a Humana or something, and we are listed there, we take it, we're credentialed with them, then you know that you can ask for us.
Because, I want to splurge on insurance. I got $100 a month. I only want a $10 copay, and I want to be able to get my discounted pharmacy, eye, vision, teeth, everything. Is there insurance out there I can go get?
I mean, there are many choices out there. Right now, we are credentialed with, if we're talking HMO, we're credentialed with Medicare, Part A and B, right? A is for hospital, but Part B is for your doctor's office.
Now stop, because you say Medicare, and people's hearing, I got Medicare, but they really got Medi-Cal. So I need for you to, explain that, because people done got that all messed up. Part A, B, and something about C somewhere.
Yes, sir. Well, we do see a lot of Part C. Medicare Advantage is the Part C, and we're credentialed with just about every Medicare Advantage plan in San Diego. I can confidently say that we are credentialed with every Medicare Advantage plan available in San Diego through various medical groups. So if there's say Molina, for instance, that's a plan that you can find Dr. Suzanne Afflalo listed as a PCP, and if you choose her as a PCP assignment, then
now
primary care provider.
Thank you.
I know. He's speaking up here like we all know it, but the folks on
they got PCP. I'm looking for PCP, LSD, and all the rest of them. You got to break it down for us.
Okay. So the PCP is your primary care provider. And of course, we're credentialed with every Medicare Advantage plan out there. What we also are engaged in is a limited Medi-Cal. So when we talk Medi-Cal, usually Medi-Cal is for people that are getting their insurance from the state. We accept Medi-Cal for patients age 65 and up, and that's if they have a Medi-Cal and a Medicare insurance plan that we often refer to as Medi-Medi. But as far as Medi-Cal, I know. Medi-Medi.
I know, because they sound like a Medi-Pedi. Okay. I see you. Okay.
But we are, obviously with Sharp, TRICARE. There are just a number of insurances out there. They're listed all on our website. But we're very homogenous. Because we have Sharp, we're not exclusive with Sharp. And so we want to clear that up. We're not exclusive with Sharp. I mean, we even see Kaiser patients if they have a PPO. And the Kaiser PPO, preferred provider organization, I might be getting my acronyms crossed up, but the PPO version for Kaiser, because we are credentialed with Cigna, Kaiser has an agreement with Cigna, so some patients, not patients that have the HMO with Kaiser, but patients that have a PPO with Kaiser can actually pass through if they have an urgent need. So we can't do managed care under Kaiser, but if someone has an ache or pain or uncomfortable situation, they need to see a doctor, they need to be visiting the doctor soon, then we can come by and do a treatment for that ailment.
Now I'm going to ask you this question because, I'm very fortunate to know a few doctors.
Okay.
What about this boutique care, where you can call? Can you get some insurance to get some boutique care with IWC?
Is it more like concierge medicine?
Yeah, that's what I'm talking about.
Yes.
Can we get some concierge with organization?
We do have a direct pay method. And it's for patients that don't carry insurance. So if we're credentialed with your insurance, that means we've signed a contract, and so we have to abide by that contractual agreement. Which taking money in addition to billing the insurance wouldn't be something that we would be situated to do. However, if a person says, "Hey, look, I don't have insurance, or I have an insurance that you're not contracted with, I would like to pay directly for my costs," then yes, we do have a setup to where we have contracts with other organizations, such as like a lab, for instance. So they might come and say, "Hey, look, I want to test my hormones." Well, we can actually use our contracted rate with the lab and bring those costs down, because the lab cost might be like $1,800 to $2,000, but through our exclusive contract, we can bring that cost down to under 300, under 500, something reasonable for someone that's looking to pay out of pocket.
But I'm gonna answer your question. No, we don't do facelifts and tummy tucks and all that boutique concierge stuff. No, we do. We will do things like telehealth, so you can sit at home and we can have a conversation with you on telehealth, or just a phone call or video call. But no, we don't do the designer stuff. You can go to your La Jolla clinics and stuff and get your tucks and nips and lips and all that stuff.
That's not what I'm asking. There's some folks that they are a little spoiled, and they like to be able to call their doctor directly and be able to say, "Look, this is what I'm feeling like. I might need for you to come over and check me out." I'm just trying to, the old-fashioned when the doctor used to come visit them at the house.
Home visits.
Yeah, home visits.
It's not even safe anymore. But anyway, I mean, I have done some home visits, but that's not the normal practice anywhere, except if you are in private practice and you have a set amount of patients that have needs, maybe they're actually homebound. Or bedbound. We will see those. I have actually seen a Kaiser member because she's bedbound. So we do that, but it's special circumstances. Otherwise, if we're busy running around the city seeing patients, we won't be able to see anyone inside the clinic, right?
I do agree. I just had to ask that question.
Yeah, special circumstances only.
Okay.
But although, there are folks out there and they know who they are, they have me on speed dial, so they're calling me even though I'm not their doctor anymore at Kaiser. But I'm always available for people to get, medical information or recommendations and things like that.
Okay. So let's get back to, because, insurance is going to be a very big thing. We're experiencing the fires in California, floods other places, winter storms in other places, and we're hearing that insurances are being canceled, or modified. How are we looking in the medical field when it comes down to insurance?
Didn't we suffer through that last year when was it Scripps, or who was it that shut down and pretty much put 38,000 patients out there?
Yes, ma'am. It was over 30,000 patients here in San Diego. So when it comes to Medicare Advantage, Scripps, ended its relationship with Scan, and so then it's just recently in the news this year, the end of this 2024 cycle. That was 2023, 2024. Anthem and Scripps couldn't reach an agreement, and so ended its relationship with Anthem, and that was over 100,000 patients.
Wow.
Yeah, and so we did acquire a number of those patients, and our phone is ringing way more than it usually rings, which is, that's another story. But that being said, there are a lot of people in the market looking for doctors, because as we get further and further into the cost of medicine, some of the bigger organizations that have executive C-suite positions, they have a lot of overhead, a lot of property to pay for, and some of the Medicare Advantage patients, they have kind of determined that the cost to provide care doesn't necessarily work out for them to be profitable. And so the cost burden has kind of navigated or dictated the relationship. And so they've turned those particular organizations away, saying, your patients will have to go seek care elsewhere. And It's sad. It's definitely sad. Anytime you have to end a long relationship with a doctor, 20 years, 15 years. Some of them are in very serious treatment. And so they've tried to make it, a means to where they can continue treatment for a certain period. But even that's been, that's kind of a case by case basis. And we've seen some sad situations where, for instance, somebody lived longer than they were supposed to. And so now they're saying, okay, we're going to have to, cut you off and you're going to have to find another doctor, even though you were on this special connection because we were trying to be kind at your end of life care. Yeah.
So I'm gonna ask you both a question, and I want you to walk me through the process, okay?
Okay.
Let's talk about healthy young people. Say they're in their, 26. That's pretty much the time where they say that you have to get your own insurance. How do they go about it? What should they look for? They're healthy. They running laps. They at the gym all the time. People say, I don't need no health insurance. But what should they basically have? And what recommendations would you give on insurance?
Well, I think the most important thing is they should get insurance. And that was part of the reason why there is the ACA, the Obamacare, is because if we had some healthy people playing into the plan, that would offset the costs of the seniors who usually require more and end up draining the system a lot more. But I will say that without it, all it takes is one appendicitis or one issue, an accident, and have no insurance, they're going to be paying some kind of way. And if you have a house or a car or something, there will be a lien going on it. You have to pay your bills. Or sometimes they may not even take care of you if you can't put something up front. If you have no insurance, I know some people that are turned away, which they shouldn't be. So the basic, the Affordable Care Act, the lowest premium, but you may have a higher deductible. So it really depends on what's going to fit their pocketbook. But I would say don't go without any insurance because that's when you're going to have something that comes up that you're going to have to pay out of pocket, and most people can't afford that.
Yes. And I want to ask this question. Okay, I get a sickness, I'm in the hospital. Why then, with all the things that's happening to the person, do they make it so difficult where they say, we're going to put a lien on your house, we're going to take your house, we're going to bankrupt you? It seemed like the bill killed them quicker than the actual ailment.
Yeah. I mean, medicine is a business. And these large organizations, they have to make a profit. So the problem is you can't continue to lose money every time a patient comes in because then you have to close your doors. So at some point, that was a whole goal behind the Affordable Care Act, is to have as many people insured as possible so we could keep the business afloat, but be able to cover people that really needed more insurance, and that's really where the young, healthy ones came in. You remember all that when Affordable Care Act came out. We needed the young people to pay into the system to take care of the older ones who have more chronic medical conditions that require a lot more hospitalizations and visits and things like that. So when people go without and something comes up, they've got to figure out, parents going to have to do something in order to help cover them. And so I don't know if you have other recommendations, but the goal is to try to have at least basic insurance so that if you have an accident or you have something that requires a surgery or hospitalization, that you don't bankrupt your family, so that you can take care of your needs.
And let me keep it real with the community for just a second here, because I thought about this last night. And I think that we have to take a step back with the community, with the underserved community, and have a real conversation about insurance and what kind of, it's not car insurance. Health insurance isn't designed for just the worst case scenario. I was walking along, something bad happened, but thank God I had insurance. Imagine if the car insurance that we had came with an oil change. It came with the car wash. It came with all these other things that we pay maintenance to do to upkeep our car. That's actually what the health insurance is, and a lot of times we sort of treat the health insurance like any old insurance policy that's designed to just, take care of the catastrophic needs or the accidental needs, when really the health insurance, we're supposed to be engaged in a way to where we are coming in for the oil change. We are getting that maintenance. We are coming in to get our labs drawn. We are exercising the preventative measures built into health to make sure that we can stay in front of any potential ailment. And that's the insurance. It's not a reactive policy that we should just keep tucked away in case something happens. And I think that if we start to have that conversation with the community more often and say, hey, look, let's treat this health insurance plan like a maintenance plan that comes along with the health insurance. So not just in case something happens, but let's go in for our checkup. Let's go in for, to take a look at our blood. Let's go in and, get our screenings done. If I'm a young woman, 26, 30, I want to make sure I have my wellness, my pap smear, right? If I'm a man and I'm in my 45, 47, 50, I want to make sure I have my colon screening. I want to make sure that I come in and if I'm feeling something in my chest, I get an EKG. Let's not wait until something happens, and that's what we're seeing.
So are you saying to value your body more than you value your car?
I'm saying treat your body like your car, right? But understand that your insurance is going to pay for it all.
Well, wait a minute, because some people got their car looking horrible.
Their body's probably just as jacked up inside, too.
If they treat their body like they treat their car, it's going to be a bad.
But treat it like a new car. Treat it like someone gave you a 2025.
There you go.
I just think that that's the direction that the conversation needs to, that's a better direction for better outcomes. Right now, when it comes to the underserved community, we see more of a reaction. I'm going to whip out my insurance policy because I had an accident. And I think that's just the wrong way to use health insurance.
But that's the reason why, me, I come from the Kaiser system. So it's all about preventative health, which means the annual wellness, the pap smears, the mammograms, the things like that, your vaccinations, your blood work, because when you do the blood work and you come in, you can then identify when the blood pressure is high. You can then identify when your sugar is high and that you're now becoming a diabetic or pre-diabetic and start taking the measures to prevent you from getting to be a diabetic. So unless we do the labs and listen to your heart and poke on your tummy and do whatever we need to do, we don't know. And then, yes, unfortunately, the underserved population, because they're so busy working, they've got to make ends meet, they've got a family, that their health is always last. And then they come in when they're sick and when they already have diabetes, that's end stage, and now they have kidney failure. So we want to really educate them on the way that they've got to take care of themselves and do their annual measurements and all the things that even the young people should come in and get exams and make sure they're up to date on vaccinations and things like that.
Yeah.
Well, can I jump in and just say that my father, may he rest in peace, I said, man, you go to the doctor all the time. He said, I'm going to get every bit of my service in the military. He said, if I got to hang there, I'm going to the doctor.
There you go.
And the thing about it is simply that many times for years we have been taught you go to the doctor when you're sick. And we don't talk about the preventative maintenance. But for those people that always talk about, I'm trying to get good deals and everything else, every year, like every quarter for me, I'm putting an email into my doctor. Could you run I need a full battery of labs and everything. Is anything wrong? No, but I paid for it, and I want a full battery of labs, and I might come back a month early because I want the. Matter of fact, I need to see you. What do you? What, I'm not sick. I just want to talk to you and see if there's anything I need to be looking at. I want you to look at this hangnail. It don't look right.
Right.
You know what I'm saying? And we have to start telling people that instead of just going when there's a problem, you know what I'm saying? Like in your car, before your car can start going chitty chitty bang bang, go ahead and get the oil change.
There you go.
So that it won't go chitty chitty.
There you go.
And so that is the benefit of having insurance. It's amazing that we have insurance, but we don't use insurance, and then we wonder why.
Right. Yeah.
So
we use it when it goes wrong. And I can understand with a car insurance, that's the way you think of insurance when it goes wrong. But when health insurance is completely different, it's a completely different entity. It's its own category.
And the problem is if you do wait and we do sick care, that's what drives the cost up, because then people go into urgent care and emergency room, and the cost of seeing a bronchitis in an emergency room is going to be 10 times more than it is in an urgent care or just in the clinic. So we wait until the last minute. the diseases or the infections or whatever gets worse, and now you're doing reactive care once again instead of preventing it, coming in early, saying, "Hey, I'm gonna have a fever, have a cough. Come on into the clinic. Let's get you squared away before you stay on those symptoms for a week or two, and now you have pneumonia." Okay, and you gotta have all the IV antibiotics and stuff.
And I'm gonna say this: the most asked question is about the deductible, and I think that steers the
Visits or lack of
the
visits.
thoughts on insurance, right? It's the deductible. And most of the time, nobody really understands the cost of their deductible. Or how does deductible work? What do you mean I have a deductible? And we have to have that conversation. Now, at IWC, we definitely have, all the patience in the world to, take a time out and explain it, because we understand that this encounter at the front is gonna be basically a pass or no pass to actually, get care, and we try not to allow things to become barriers to care. Mm-hmm. And so we've put people on like a payment plan. Mm-hmm. So like if deductible is a certain amount and you can pay 75% of it, something like that, then we're gonna try to work with you, because we don't want somebody to come in and they have that deductible payment and then the payment alone is like, oh no, I'm out of here.
Well, I just want to say I'm a Kaiser member, and I've learned how to negotiate the system.
Right.
And I think that when they see me come, they say, "Father Jesus." Because I go to the emergency room, everything, they were like saying, "Oh, well, you're doing good. We're going to release you." I said, "No, you're not. You're going to admit me. You're going to admit me even if it's for 2 minutes."
Yeah.
And they be like, well, sir, we're not. Yes, you will today, because if you admit me for 2 minutes, I'll have to pay that $100 deductible.
Exactly.
But if you let me go, then I got to pay $100 deductible. They be laughing at me. And I'm like saying, so I'm getting ready to pass out. Y'all better go. So here's the thing. Understanding healthcare insurance, you keep saying preventative care, sick care. What are the different cares when people come in? The first step is what? Preventative?
Yes. I mean, just a routine health evaluation. I mean, that's head to toe, eyes, nose, throat. It depends on the age. I mean, you could do it annually. We definitely recommend it for our 65 and over, our seniors, annually. That's why they have an annual wellness exam. We like to do it at the beginning of the year. Less than that, if you're in your 20s and stuff, sometime, if you have insurance, you might as well use it. Come every year. Even though there may not be much we have to do, because you don't have a lot of screening things. You don't have now we're not doing a pap smear every year. We're doing it every 3 years. You can still get your breast exam for a young lady. Obviously, as we get older, we start doing screening things like colonoscopies, obviously the mammograms at a certain age, pap smears, things like that. But before that, we still need to just kind of check. Because you may not even realize when we lay you down and poke on your tummy that there might be a little bit of a mass that we feel. Mm-hmm. Then we can order an ultrasound to see what's going on,
And the screening is free. Actually, the health insurance covers that. We don't have to, engage in copay or deductible. Mm-hmm. So to not come in for that preventative visit when the health insurance is on the hook to pay for it, that's the one thing that we should be coming in for.
I think we need to change our advertisement, like, hey, coming in for a health screening. It's covered.
It's covered.
You know what I'm saying?
Yeah.
We need to say it.
Yeah.
Preventative care at its best. The thing about it is I really don't think people really understand insurance. Mm-hmm. You know what I'm saying? We hear it. Mm-hmm. And we hear that all these different things. I wanted some Afflalo. Mm-hmm. You know what I'm saying? Mm-hmm. I heard Afflalo. Mm-hmm. Then when I went to go talk to Afflalo was expensive.
Yeah.
But you know what? But here's the thing. Mm-hmm. But I had Afflalo when I was in my 20s.
Right.
And it was like $30 a month.
Right.
I should have kept that Afflalo.
Yes.
Because it could have came in real handy as I got older. Mm-hmm. So what other insurances should we encourage young people to get while they're healthy and strong? When it comes down to, because what I'm talking about, you have your health insurance, but there's the long-term care and other things that you can add on to that.
Yeah, Yeah, long-term care is important, and people don't realize that, but you can get disabled at any point. And so I think I started my long-term care maybe at about 38, and it seemed like it didn't make sense because you think it is for the seniors that have a stroke and, somebody got to wipe their butt or whatever. But actually anything can happen to you. And if you now need care at home, you can't work, and it's going to be more of a chronic or permanent thing, then that's where long-term insurance comes in. Like 90 days after, you can actually start getting paid. And it depends on what policy you have. You can have care in your home, where it'll pay $400 a month, $400 a day for someone to come in and take care of you. Or you can go to a skilled nursing facility or something like that if you need some rehabilitation and the people at home can't take care of you, don't have the right space for it. Those daily visits or those the days that you stay in there are covered by your long-term insurance. So, we're healthy and we don't think about it, but a good insurance person explained to me the need for it, and that's why I started paying into it at a young age. And you may not ever use it, but the point is that's what insurance is all about. When you need it, you better have it. It's better to have it and not need it than to need it and not have it.
Yeah.
Right? So that's long-term insurance. And the Afflac does supplement things when some of your insurance doesn't cover that. Afflac kicks in, so you're kind of even and you don't have to pay out of pocket for things like that.
Yeah.
Yeah. And so one of the things about it is, let's just talk about insurance in the inner city communities. I think that has been one of our hurdles, and I believe that's one of the things of why IWC Primary Care came into existence, is to make people feel like it's okay to go to the doctor. It's okay. There's a safe space. You know how everybody said, this is going to be a safe place for you to talk and share your energy. That's what I see IWC Primary Care is that it's a safe place to ask real questions that you might be going through, but it is of the top notch of care.
Mm-hmm.
You know what I'm saying? Yeah. So let's talk about how do we get our inner city families to engage in insurance even when it seems like it might be out of budget.
Well, I think that what we're doing right now, since we're in the underserved community of Spring Valley, it's a very homogenous community, right? It's people from all walks of life. But we do see a high concentration of your Medicare Advantage patients. And usually Medicare Advantage patients are patients that want something that's not only affordable and makes sense for their budget, but they also want, if they took just regular Medicare, they won't have dental coverage and vision, and that's the complications with just Medicare Part A and B. It there's nothing to address vision. There's nothing to address dental, and so when you're considering that, it's like, well, I might as well get something that covers my dental and my vision so I can have a complete package. And so not only that, then they cover the prescription drugs. Mm-hmm. And so you're not going to get, more of your Medicare Advantage population in the North County. And so because we're situated in the South County, a lot of the few organizations that were taking the Medicare Advantage, like Scripps, when they ended that relationship with the Medicare Advantage plans, that started the journey for some people to start looking for care in their neighborhood. And so what we do is we try to push the limit at being the highest performing healthcare organization in and around our community. And so when someone walks into a Kaiser or a Scripps or to any other organization, they can't tell the difference. And then a lot of times they come in and they see that the Sharp brand attached to us, but with their Medicare Advantage, the question is, do y'all even take Medicare Advantage? Because I see Sharp. And normally when there's a Sharp clinic, it's usually exclusively Sharp. Mm-hmm. But Dr. Afflalo and I was a fly on the wall in this conversation. When we started our journey, we were actually, Dr. Afflalo was actually particular about not being exclusive with Sharp because of the needs of the community. Mm-hmm. And so then, so we take being a high performing organization right into the health fair that Dr. Afflalo and the team, we are out in the field at the Jackie Robinson Y, and that is another way that we tackle the challenge of bringing healthcare to the inner city. And I think that between the health fair and the medical practice, you know, located right in the heart of the community, I think that we're doing a really good job at leading the way at making a difference. And there are some other organizations out there that are doing well, but I think we're right up there in the conversation amongst the best.
Well, I'm gonna ask you a question, Dr. Afflalo, because see, people don't know how important your teeth are to health, and your eyes are to health. So why is it that they have kind of broken up dental, vision, and then medical when it seems like they all tie together? Why can't I just get a blanket insurance and just go in and get it all?
Well, because it costs. And so the health plans want to keep the cost down for themselves. So if not everyone may see the value in having extra coverage to cover vision and dental, but if you have sense, you will know that something's going to happen. You'll have some oral issues, and oral health is important. And visual health is important because you can actually go blind if you're not checking for glaucoma and things like that. You can actually go blind, especially if you have chronic diseases like diabetes. It affects the eye. You have to have a retinal exam every year. So if you're trying to cut corners, you just may get, Medicare, but you're going to end up paying out of pocket if you end up having a problem with your eyes, not just a routine eye exam. And you can go to these little places in the strip mall and just get a eye exam, but that's not the full eye exam. You want to look on the back of the eye. You want to see the retina. You want to make sure, especially with chronic diseases, that you don't have retinal. You can see diseases when you look in the back of the eye. You can tell when the cholesterol is high. You can tell when you're having diabetes that's out of control and it's affecting the retinal area. So, and then your dental, when you start losing your teeth because your gums aren't healthy, who's going to be extracting them or putting you an implant or whatever, you need to have coverage for those things. So don't take it for granted, especially when we don't do well by taking care of our oral health anyway. They're not doing their regular flossing and brushing and gargling or whatever, that you start getting gum disease, gingivitis and stuff, and it can cause infection, which can seed into your heart and cause all kinds of issues. So it's important that we have health coverage all over, but some people are trying to cut costs to fit their budget. At the end of the day, it ends up costing you more because of all it takes is one issue, and then you're paying a few $1,000s.
Now, I'm going to ask you this question. What about the hustle? I went to the dentist the other day, and they said, oh, your teeth look good, but we think we need to do a deep clean. And I said, okay, you want to do a deep clean? Okay, that's included in the insurance. Go ahead and do the deep clean. Oh, but we got this new thing that shoots ultraviolet lights down into your gums, and it kills all the bacteria below the gum surface. That's going to be $800. And I'm like looking at them like the devil is alive. If you go deep clean, why can't you kill the bacteria that way? When do we know that it's needed, and when are we just being upsold?
Ooh, that's a good question, because there's some hustlers out there that have a good game, and they'll convince you that you need it. But if you take care of your teeth and you get an exam every 6 months, get a cleaning every 4 to 6 months, whatever, and your X-rays annually, then they can tell you if you're going to have issues with needing a root canal. If you're not symptomatic, if you're not having bleeding when you brush or floss, and if you're not having tooth pain and you're doing the proper things for oral hygiene, you should be able to just get away with getting your regular clean. I'm not sure I've never had a deep clean in my life, because you just get your regular cleaning, right? And so I'm not sure. You may just want to say, I'm going to pause on that. I'm going to think about it. And if anything, I'll do my research and I'll come back at my next cleaning and determine if I need a deep clean. And then you can research all that other stuff you're talking about, the ultraviolet light, which I've never heard of, right? So because some of those other things are covered and they don't get a whole lot, the insurance pays them pennies on the dollar for seeing you, they want to make a little more money off of you. So they may be selling some things that you don't need. So I would just say pause on it. Right. Go in for what you went in for, and then do your research and come back. And if you think it's something you need, or you have a conversation with a few other people and it's worthy of your money, then go ahead and do it.
Yeah, and I believe in barter and trade. I thought, look, I'll give you some commercial time, but it ain't going to happen any other way. So let me ask you this question. I've been hearing this battle consistently. I got insurance, and I go into my doctor and say, look, I need an MRI on my knee. And they, well, no, we don't think you need an MRI. How do you navigate if you got insurance and it's covered and they won't give you an MRI because they don't think you need it?
Well, it's you need to do the proper steps. So you have knee pain. You should go in and be examined, because on the exam we may be able to tell you what's going on. And then if we can't because there's some soft tissue, then you should at least get, it depends on the injury. If you just start having pain, that's one thing. If you have an injury, a fall or whatever, and now you have a big swollen knee and you have instability with walking, you probably tore something, which does require an MRI. So depending on your presentation or an injury that came in, an MRI is necessary. But if you're coming in with garden variety knee pain, you're 50-something years old, and we know you have arthritis, the first step is an x-ray. And then rehabbing and doing things that's going to help the knee, because arthritis is arthritis. It's going to flare up when it wants to. If you overdo it, this is wear and tear over the years, right? And one day it's going to be fine and another day it's going to hurt. So we can tell you how to take care of it so it's minimal. But if you don't have an injury and you don't have anything on exam to warrant an MRI, then that's a waste. And that's going to cost the insurance something that's not necessary. Some insurances require that they approve it. I mean, at a Kaiser system and closed system, you can order if the physician does an exam and feels that it's warranted. But there are protocols. Do an x-ray, make sure it's whatever, or if it truly is an injury and you see on exam the knee is has some instability on exam and is a big old watermelon there, that's an MRI automatically.
And the reason why I asked that is because I know some people that requested MRIs and were refused. And then some people that didn't look like them requested an MRI and got it without any question.
No, well, that's...
How do we navigate that? Because, it should be a fair system because we're both paying the same amount of money.
Well, let me jump in and say that I think that's why IWC primary care exists. And there's a lot of fairness and unfairness out in the world. We deal with it every day. But I do think that, and it's well documented, that women of color, for instance, there's a huge issue with the mortality in maternal health. And so sometimes when we go in, we're going to get 5 minutes. Sometimes when we go in, we're going to get 10 minutes. But at IWC Primary Care, we try to make sure that it doesn't matter what you look like. You could come in, however, we're going to give you a long visit to where you're heard. And that's our, that's what we're known for. That's our culture, is to provide enough time in the appointment to where if someone has knee pain, we can go through a thorough examination to see you as a person. Whether we see you as uncle, auntie, grandpa, dad, mom, but we see you. And because we see you, then we can listen and determine exactly what Dr. Afflalo just said. Now we can make our determination on how we're going to treat you. And we get patients that come in, and you can read right on our reviews, it'll say, oh, this is the first time I've been heard. This is the first time anybody's taken the time to actually listen to me. And so, being refused medical treatment or getting the abbreviated treatment is something that sort of opened the door for us to come in and be very disruptive, especially in the underserved community. Because just because you have a plan that's subsidized, like a Medicare Advantage plan, doesn't mean that your treatment should be any different from somebody that has the highest cost of insurance out there in the city. And I tell the patients when they come in, a lot of them come in with little apprehension because of other experiences, right? I always share the insurance is only as good as the doctor. And so if you can have the best insurance in the world, but if the doctor doesn't see you, if the doctor doesn't want to listen to you, if your appointment is 5 minutes, less than 10, if there's no eye contact when we walk in that room, then it's not the insurance, it's the primary care provider, the PCP, or in TRICARE world, a PCM, primary care manager. And we need to change that primary care manager to somebody that's actually going to see you as a person. And then now the insurance starts to come into play, because now the person who directs the insurance is in the right seat. Yeah. And that's what we need to get to. And that's the conversation we have.
Yeah, and that's really important because, I recently went to the doctor and I felt like I was on display because it was a teaching hospital and everything like that. And it was time for the grand old check the prostate, and I wonder why everybody was there and why they were still talking while they was checking. And I had to stop and say, "Y'all finished?" You know. So what I hear IWC primary care does is it actually gives a personal touch, but with much respect, to give the time for those people that are insured, and if they're not insured, you show them how they can still receive their care, and you work with them.
Yeah.
So, with that being said, if you were to, let's just have table talk right now. Okay, we're around the table. You know, auntie, uncle, mama, daddy. You know, the kids is all there. You got kids that are now 21 years old, just graduated from college. You know, they were smart. They got out early. You know what I'm saying? So you got young adults at the table, and you guys are talking insurance. Okay, so we got the 20-year-olds. What are we gonna tell them?
They're still covered though under their parents' insurance.
But,
They should be.
but hypothetically, if they weren't covered, we would tell the first thing I would tell them is read your policy.
Now, wait a minute, hold on. Now, y'all didn't hear me. I told you they graduated from college.
Yeah.
So they got good jobs now.
Right.
One working at IBM, the other one working at Sony. You know, so they got these packages now, and they want to know what to get.
Yeah, I think that, you know, again, like the biggest point of confusion that I've observed is a deductible. What is it? How much it is? Some deductibles are $3,000. Some deductibles are $7,000. Right? And so when we come in and we think, okay, I have insurance, so I just got a $20 copay. Yeah, but you got to pay the deductible in full before the insurance even kicks in. So, for instance, if your deductible is $5,000 and you come in and you want medical treatment, well, you're going to pay up to $5,000 over a span of however many visits it takes to get to $5,000. Then the insurance is going to kick in. And it's like, well, why am I paying the insurance? And I done heard that is ringing in my head. Well, why am I paying the insurance if they're not going to pay for anything? And we have to say, well, that's the part of the insurance policy that we have to read.
And that's the plan that they chose because
Yes.
you can choose a plan that costs more. So in that $100 plan that you were asking for earlier, you're gonna have to pay about $10,000 deductible before
That's
you.
a good plan. When
Yeah,
it came
yeah,
up, yeah.
but you would never get the benefit of it because
Yeah.
you would be paying out of pocket for $10,000. But if you pay $350
There
or
you go.
$400 a month, those things will be covered. But you're gonna end up paying every month, and that's the part where they feel the pain because I'm not sick, I'm not going in, I'm just paying $350 a month for what, right?
I disagree with you, Doctor. Afflalo. In 1970, $100 a month was a whole bunch of money. Let me ask you this: top off. What happens with your insurance? Are there ever a time in insurance where they say, "Look, you done spent all that we can spend on you, and we can't spend no more"? Is there a top off in insurance?
Actually, it's the reverse. It's a max out of pocket for the patient. And so I would encourage patients to read their max out of pocket because at some point, if a patient pays and their max out of pocket is $2,000, then it doesn't matter what they come in after that $2,000, the insurance is on the hook for it. And that max out of pocket is very important. Because, you know, we've seen patients that, for instance, they've had some issues, they reach their max out of pocket, and then they might be delivering a baby later on that year. All of it's covered because of that max out of pocket is
So
reached.
there's no top off, but it's on that front end.
It's well, the only top off is if they lose their insurance because they lose their job. You know, insurance. A lot of people struggle to hold on to insurance, but you know, those two are kind of, it's an interesting dynamic at play there. A lot of people, if you are in a stressful situation on your job, we should be using our insurance to come see our doctor because our doctor can extend our life, you know, there on that job by putting some medical protections in place. Stress, anxiety, depression, all of these things are treatable. And there's a thing called the Federal Medical Leave Act that a lot of people don't ever exercise. One, because they don't know about it. Two, because sometimes when you go to a provider that doesn't see you, they'll tell you, oh, ain't nothing wrong with you. You need to get on back out there to work. And then it's like, hey, well, you're not hearing my issue I'm having.
Have a good steak dinner. You'll be okay.
Exactly.
So let me ask you this question. In most healthcare plans, is the psychological and mental health issues, are they addressed in most medical plans?
Well, yes, because mental health and physical health is still health, so it's covered. So you should be able to go to a therapist or psychiatrist or whatever. Sometimes your primary care provider can handle some of those mental health concerns. But yes, that is covered.
So my question is, why when you tell them that you got issues, doctor, I have issues and I need to see a counselor, why does it take 6 and 7 months before you get to see a counselor?
Because there's not enough counselors out there.
Yeah.
Okay.
Yeah. And a lot of
And
times,
everybody's got a mental health issue, so get in line.
Yeah.
I mean, there's not enough providers, truly.
yeah. A lot of times, the providers at IWC end up, getting, as Dr. Afflalo refers to, as the social visit.
Yeah.
We're here to talk about this, but since we're here, this is what I'm going through. Yeah.
And that's part of family medicine, to be honest with you, is encompassing the entire patient. So their headaches that they come in with, their neck pain, their back pain, sometimes it's usually a situation that's causing that. They're stressed at home, and they have physical symptoms that's presenting because of the mental health or the stress at home. I promise you. As soon as we get rid of that husband or that crazy child, then the mother's headaches go away.
Baby, you need to move. That's the best health care I can give you. You
Yeah.
need to move, baby. So, with all the insurances that are out there and with so many different medical needs that are popping up right now, are there insurances for people, and I want to say extreme sports people and gamers? Because some of the issues now with gamers is that they have injuries that just seem to be different now. They have hyperextended arms and things of that nature because they in virtual worlds swinging and hitting walls accidentally and everything.
It's still, I don't think there's any extra thing.
Yeah.
It's just a presentation where we have to address it, find out what they did to have that injury, and then address it. Whether it's we need an x-ray or if they've torn out their rotator cuff because they're swinging at something, we have to get an MRI, send them to ortho, do whatever, maybe have surgery. So it's still covered under the general health.
So let me ask you this question. Say, for instance, I just happened to lose my job. And I miss a month of covering my health care. But then the next month, can I get back in or I got to start off all over from ground zero again?
Yeah, that's a tough one. And I think that if we are experiencing difficulties on the job, depends on why we lose it. If the company's being sold, okay, that's a loss. But sometimes our jobs are taken from us and we aren't in our best selves to kind of deal with it. And so we need time off. I've seen patients use their health insurance, take some time off, come back with a clearer sense of direction. And now instead of the job being taken from them, the job was actually paused, then now they return still in a sort of like a situation where they're still in care. And so the job has to, be a little bit more hands off. And now they can kind of decide on what they're going to do with their future. But a lot of times in the underserved community especially, our jobs are taken from us. But if we lose our job, sometimes we can pay into this after Cobra and still continue to receive care if we are in a health insurance plan that we're credentialed with. And that's the tough part, There are 4 big ones out there. Kaiser, Scripps, Sharp, which we're contracted with, and UCSD, which we're announcing tonight that we've started the conversation with UCSD. And so we're going to be in 2 of the big 4, UCSD, Sharp, and all the other Medicare Advantage plans, et cetera. So
now I'm really liking this information that you gave. So what you're really saying is, if you think you're on the verge of losing your job, you better go see your doctor and get a pause.
Yes.
See, now, if y'all don't get nothing else, for those of you guys that are having some troubles on the job, you might need to go see your doctor and get a pause and be able to take off. How much time they can take off?
They can take off 90 days per calendar year if they've worked at least a year on the job, and that's the Federal Medical Leave Act.
But we can't write it off all at one time. You have to come back for a visit and doing it. We have
Right.
to reassess you.
So
Yes.
how many times I got to get reassessed? Because I want the full 90
Yeah,
days.
well, you might have to come back every few weeks.
Oh,
Right.
okay.
Yeah,
Right.
some organizations say you can't put them out. Like at Kaiser, we used to put them out a month at a time. It's like no, pump the brakes. You put them out 2 weeks and then send them over to psychiatry department. But it would take forever to get over there, so I'd write up another 2 weeks or another 2 weeks. But before we could put them out a month. But you do have to reassess, because how do you know they haven't improved in 90 days, right? Some people do milk the system. They're out on stress leave. We have to pay for somebody else. I'm just thinking about Kaiser. They have to pay for someone else to do your job and pay you. Right, so they don't want you out, but a lot of people are harassed on the job, so it causes mental health issues, and they rightfully should be out on a pause, getting the support that they need, and we can write them off.
There you go.
Yeah.
Yeah.
So I like those strategies. I'm going to end off with this big question. Now that they say DEI is officially going to be gone,
There you go.
how is that going to affect how many people are going to be impacted on their jobs with stress-related illnesses?
Yeah, it's going to be almost everybody.
Yeah.
Unless you have, like, you're in a state that's going to say we're still going to keep DEI, or in organizations. That's the federal jobs, right? At this point, they can't touch the private jobs.
Yeah.
But it's going to be horrible.
Yeah.
And so people are going to be stressed out, whether they go and seek care and be out on stress leave. But they're going to, I wouldn't be a bit surprised if people start taking their own life because of it.
Yeah.
Because they've lost everything in 1 second on a pen writing
Yeah.
of something, right?
But coming in to see a provider, if you want to take that pause, a lot of times they even go on short-term disability, and so it's not like they're left without resources. And so seeing a provider that sees you, hears you, understands you, sometimes can relate, right? Now we can take a serious assessment of what's going on and what's best for the patient going forward. And then if this patient qualifies for the time off and for the short-term disability, then having a provider again that can make that determination with your best interest in mind, not with like their own selfish reasons for being in healthcare. These are our team, and I'm speaking bias. So I can recognize that in a moment, but it reflects in our public reviews. At IWC, we really put in the time, and I think that that's why the other organizations like UCSD, Sharp, that's why they've taken notice of what we're doing in the underserved community. Right,
Absolutely.
They visited the site.
Yes.
And Dr. Afflalo, led the conversation, and I can tell you, they were blown away.
Yeah, they were.
So with that being said, in our last 2 minutes, let's talk about the upcoming clinic and what is getting ready to happen, and might want to shoot out the dates for the year.
Okay, so of course we have February 5th is going to be the first health fair for this year. We usually go dark in January, so we are February through December, first Wednesday of every month at the Jackie Robinson YMCA. We're there from 10 to 3, and we provide a lot of services, all your routine health screening, meaning get your blood pressure checked, blood sugars. If you have diabetes and cholesterol, go ahead and get those labs done too. They're all done there for free. We do have fresh produce there that's donated through Feeding San Diego and San Diego Food Bank. Lots of other services are there, including the Humane Society to take care of your fur babies. But I will say that, February is Heart Health Month. So I'm begging everyone to come over and at least get your blood pressure and get your blood sugar done. Those two conditions, if you have hypertension and diabetes, those two conditions put you at risk for heart disease. And next thing you know, you have congestive heart failure and all the other things that come with it. So do yourself a favor, come out to the health fair on February 5th. It's the first Wednesday of the month. And get at least your blood pressure and your blood sugar taken. It's all free.
Okay, and this weekend, is there happening something at the Martin Luther King?
Yes, so the Martin Luther King Parade and celebration over at the Skyline Rec Center and the soccer field and the senior center. We're also doing Kaiser's whole volunteer team is doing health screening there, blood pressure, diabetes, and consultation with some of the physicians. And then I'm going to have another team inside the senior center doing the same thing, blood pressure, blood sugar, health screening, and things like that. So you can come out on this weekend. You can come out on February 5th.
Well, one of the things I want to do is applaud IWC Primary Care for their outstanding work and also for their heart for the community. This conversation was about health care and getting your insurance. Now, you got to treat your body just better than you treat your car. Now, I want to say that again. Treat your body better than you treat your car, and we will see that we will be better for it. I want to thank you both for another edition of Ask Dr. Afflalo right here on GOD Radio 1. Y'all have a blessed evening and take a listen.
Are you seeking personalized medical services that prioritize attentive listening and addressing the underlying cause of your health issues? IWC Primary Care, part of the esteemed Sharp Community Medical Group, has opened a new clinic in Spring Valley. Our mission is to provide high-quality medical care in a compassionate and patient-centered environment. We are providers who listen and providers who care. IWC Primary Care Clinic is located in Spring Valley at 10225 Austin Drive, Suite 105, conveniently situated in the same building as Sharp Care. We accept all Sharp health plans, as well as most major insurance plans, such as Medicare Advantage and commercial plans. IWC Primary Care, a Sharp Community Medical Group clinic, owned and directed by Dr. Suzanne Afflalo. Visit our website, iwcprimarycare.com, or call to book an appointment, 858-648-0755.